So I want to just kick off with a couple of the questions. And Britta, I loved your take on the first day. And you obviously spoke about the first day being very typical as a first day. But some babies' first days are not typical. And for some babies, they end up in the neonatal ICU. And one of the questions, and this is a question from Warren, was any advice for parents who'll probably have children that are in the neonatal ICU? What should we be looking at?
Sure, it's a difficult question because I think it depends a lot on whether or not that was expected and whether or and what the reason for neonatal ICU is. I touched on the fact that nowadays most hospitals are there's no nursery where the baby goes to to be looked after by the nurses. That the baby goes to mum, and a lot of the baby care is left up to mum, which is really great. But there's nothing. A lot of hospitals then have got very little in between that scenario and neonatal ICU. So if there's any question as to the safety and the health and the condition that the baby is born, often the baby will then need to go to neonatal ICU for observation. There's different levels of observation and care within the ICU, although it's all within what the ward's name is neonatal ICU. So if you're in that situation where baby goes to ICU, you're not quite sure why ICU sounds like such a big scary word, and you go there and there are other really sick babies around, don't necessarily panic. Find out exactly why the baby's going there and what it's for. A lot of the times the doctor will explain it's for observation. It's because we're not 100% sure that this baby can be essentially discharged. Because for a baby to go to mum, the baby should be able to go home. So I think just find out exactly what's going on and how serious the condition is before you panic. Secondly, I think the biggest, it's the most heartbreaking thing to separate a mom and baby, and it's really not natural. It's not the way it should be for mom or for baby. So it is, it's a very, very difficult situation for parents to be in. But I think you have to. It's the first time you'll learn the same lesson over and over again, is that it's not in your control, and going forward, lots about your bringing up your baby and your child is not in your control, and you have to deal with those things as they come, and that's probably the hardest way and the quickest way that you're going to learn that exact point.
Yeah. And I know that Daniela also mentioned how absolutely critical breast milk is in prem babies in particular, in all babies, but really in prem babies it's incredibly important. I don't know, either Britta or Daniela, how do we start that breastfeeding process when we've been separated, when the baby's in the NICU, bearing in mind how essential breast milk is?
So we simply have to mimic what the baby would do in that circumstance. And so Britta's presentation was the perfect example. You mentioned early, having the baby to suckle at the breast early and have the baby suckle frequently. And so we need to mimic that somehow, and that's usually with a breast pump and hand expression as well. And so in those circumstances, the sooner we can start to stimulate the breast, it gives it the signal to start producing the milk, and then back that up with frequency and trying to express the breast every 2 to 3 hours. And that's going to be the best start to kick off. Yeah.
And I think what's really exciting, mums, if you do end up in that situation, is that we know many mums, and there's lots of evidence that you can go on and successfully breastfeed, even when that start hasn't been optimal. But that early pumping is completely critical to that particular journey.
Exactly.
Yeah, absolutely. So things don't always go according to plan, and I think that Tom's talk really highlighted that you can have the ideal scenario in your mind where you're going to give birth naturally, but actually, and while for only 15% of mums should be requiring Caesars, it's a lot more that are requiring Caesars. So one of the questions that came through from Susan, and so that previous question, Warren, you win a prize, so please come up afterwards, and Sinead will be giving you that grand prize for that session. And then for Susan, she's also asked a very interesting question, and hers is relating to Caesars, Tom. Her question is, if you have a Caesar, what should you do to heal the cut? How do you clean it? How do you know what to do? What sort of care should you be taking of your Caesar?
Once we discharge the patient, we tell them to maintain general continuous hygiene, clean the place, make sure it's dry and not damp. There's some of us who are privileged to have a small little tummy that falls over the wound. We ask them to make sure that they put in a pad to absorb the moisture so that the place keeps clean. So the main mantra we say is keep it clean, wash it or wipe it twice a day or 3 times a day. The same spirit that you use for the umbilical cord, you can use it to make sure the place is clean and dry. If you see any form of infection that is starting, it's important to visit your healthcare provider so that we can either start antibiotics or give you an antibiotic cream that you need to apply there. But otherwise, it's not difficult to keep it clean and prevent an infection.
Okay, excellent. And how would a mum know that she's got an infection?
Normally, if we tell them that if the place becomes more painful than normal, there will be pain. And most of the time, there is pain at the ends of the incision because that is where we put in the stitches. So if the pain is more than abnormal, I mean, pain is pain is pain. You are 3, maybe my 4, my 10. So if there is more pain than normal, then that may indicate an infection. And secondly, if there is induration and swelling around the wound site, which is either at a specific point, a specific place in the wound, or at the ends of the wound. And obviously, if there is what looks like pus coming out, then there is an infection. In a case like that, one needs to see a healthcare provider as soon as possible.
Immediately. Okay, excellent. And just another question, and I don't know which one of the experts will be able to answer this, also from Susan. So Susan, you do need to come up and get one of the spot prizes afterwards. And it's a fabulous question. Actually, Britta, you mentioned how important skin to skin is. How soon after delivery will your baby be put on your chest? And is this something that, Tom, your patients have to ask you for, or is this something that happens naturally in a labor environment?
I'll probably answer that. In the birth plan that I didn't mention in my presentation, many moms ask, when can I start breastfeeding? And I've had an opportunity of doing a Caesar, and Britain was my pediatrician. As I'm doing the operation, the baby is already on the mother's breast. And as soon as the mother moves from the theater table and goes into her, even before she leaves theater, we encourage moms to start breastfeeding immediately.
Okay, excellent. Are there any other questions, any other answers there, Britta, or is that? You can just pass them back, yeah.
Yeah, exactly in line with what Tom's saying. Tell the first person you're going to have this chat with will be the gynecologist who you discuss your birth plan with. So definitely mention it to them. Hopefully, I mean, depending on how the baby is delivered, even if it is a cesarean section, the pediatrician will be there before the baby actually comes out most of the time. So don't feel shy to tell them as well. Often the gynae, by that stage, especially if it's an emergency Caesar, is focused on, doing the surgery and doing it safely. So tell the ped also, please, can I do skin to skin as soon as possible and latch as soon as possible as well. Obviously, baby's health comes first, so the baby must be breathing and be healthy. But once that is established, then there's no reason why you can't do skin to skin immediately.
Okay, brilliant. And Nesego, I was amazed and quite daunted, actually, to be honest, by how you have this amazing fitness regime, and you've managed it all the way through your pregnancies. I think 90% of mums in this room have not managed that in their normal life, never mind in their pregnancy. But I also think that being a mother is such a hard part of life, and there's a lot of criticisms that mums give to other mums. And so how do we have mums who support each other as opposed to judging each other, and how do we create a community that inspires us to be active but also doesn't kind of intimidate us, as I might be feeling?
Yeah, intimidation is a big thing. And, I often say to people, if you're confident in yourself, the little bit that you're doing, if you're able to at least get off the couch and do something for 5 minutes, you've won the day. So, it's unfortunate that we put so much pressure on each other, but you've only got but yourself to get yourself through every day. So pat yourself on the back for being able to get off the couch and walking around the house. That's a little bit that you can do. And yes, you'll have the crazy litsegos that will go and run marathons, but like I said in my presentation, don't be too hard on yourself. We're all on our own individual journeys. Just keep moving. That's my tip. And if your movement is going to the gym and walking in the pool from one end to the other, then the high five to you. So just try not to succumb to the pressures. Society's just
can be tough.
Terrible.
And then our final question for this session, and Gugu Mkhengi wins this prize. This one is probably for you, Daniela. She says, are there any breastfeeding tips that you have for moms with flat or inverted nipples? Can they breastfeed, and how does that journey happen?
Okay, so yes, they can breastfeed in the majority of cases. And so what normally happens, just as I showed that the breast is changing a lot, the nipple is also changing a lot during the journey of pregnancy as well. And so we do see that there's a lot of mothers who are fairly, inverted during pregnancy, that after a few weeks after the birth, they become everted. And so that naturally resolves. And then there will still be cases where, now we're getting to smaller and smaller percentage of cases, where you may need to actually apply some kind of stimulation prior to breastfeeding. So you can use a little bit of a pump or a syringe and just try to evert the nipple. And then if that still doesn't work because you have a true inversion, then I would definitely seek the advice of a lactation consultant to make sure that they can find the right solution for you. But don't be too put off, because everything is changing. So, over the course.
That's brilliant. Yeah, and I think it's a good place to end. The most important thing is that if breastfeeding isn't coming easily, and Britta, I know, had a very hard journey with breastfeeding first time around. I hope this time it's easier. And I did too, all 3 times. Absolutely, it's critical to get a lactation and consultant involved. If you feel like that latch is not right, if it's painful, if you feel like your milk isn't coming in rapidly enough, get yourself a lactation consultant. They really are, a godsend when it comes to breastfeeding, and fabulous. Yeah. So thank you very much to our incredible panels, and thank you to all of you for your questions. The 3 or 4 names that I mentioned, please would you come up afterwards and come and get yourself one of our spot prizes, our amazing prizes. We are going to take a break now. In our next session, we're going to have some more incredible prizes coming up. They get better and better through the day, so please come back. This tea break is only 20 minutes, so it's literally a coffee and a muffin over there, a little bit of having a look around outside, and come back in and join us. Our next session looks at all the critical stuff that happens in the first 6 weeks, in the first couple of years of life, at technology in your babies, at colic, at feeding to avoid allergies. So please do join us. Thank you very much.